Guys, we're back and we have our next patient. We're going to work on the glabellar region on this patient. All right, so what is the glabellar region? Remember, it's the two corrugators, one on each side. It's the procerus muscle and it's the depressor suprasoli. Just a quick refresher, the two muscles in the glabellar region, which are right in the center above the nasal bone, your depressor suprasoli and your procerus. What do those muscles do? Those muscles are strong depressors, all right? They're strong depressors. So when you inject in this area, the eyebrows will come up. You're going to relax those muscles and you're going to create actually a lift, a central lift to the eyebrow. So it's a nice effect. It's also something that you need to do even if the patient just comes in asking for you to treat their frontalis area. Okay, we talked about this before. It's really important because they don't understand all this. They're not supposed to know that. They're coming to you and they're asking, they'll point out, they'll say, hey, doctor, nurse, whatever, please work on this area. I have a lot of lines there. So you have to make sure that you explain to them that not only do I want to inject the frontalis area, but that I also have to, basically you're balancing it off, all right? So you want to also inject into the glabellar area to create that lift, all right? So it's a really good effect, and this is what we're going to do. Okay, so she's already been wiped off, okay? Already did alcohol, and now we're just going to start right in the center. There's really no significance to the order. We don't have to do the corrugator first or the procerus, but we're just going to start right in the middle over here, all right? And just inject 4 units right into the center. And I know that this patient is so good, she doesn't even feel a thing, right? You didn't even feel that. Okay, the next one now is the corrugators. Okay, now take a look at, I want you to see this here. If you could see the border of the corrugator, okay? So make it frown really, really tight. So if you could see, again, make it really tight and try to leave it there. So frown and keep it tight, okay? You could see the lateral border. I'm gonna go on the outside, but it's basically right over there is the lateral border, and then on this side is over here, all right? And frown again, and so you have this whole area. The central area is right over here. She stopped frowning, but that's okay. We could figure it out. And there. So this is your corrugator muscle. These are pyramidal shaped muscles. All right, they're kind of strong muscles. All right, so what you want to do is you want to inject into the belly of that muscle, but careful, we talked about this earlier, don't go too deep. Why? I wish there was somebody here I could test them to see if they know. You don't want to go too deep because if you do, you potentially could hit some of the fibers of the frontalis muscle because your frontalis muscle comes down and inserts into that area. All right, so you want to be very, very careful not to go too deep. And all you have to do is, and we showed you this on the other patient, thank you, is when you pinch the muscle, because the pinch technique, you want to make sure that you're on the bottom part of the orbit, all right, and you're just coming in like this, all right, and you're just going right into here. Okay, 2 units there. And frown again. Okay, and you see we marked it off. Now we're going to get more of the lateral border. And she's saying that she doesn't even feel it again. Okay, there's that. Now we're going to do the other side. So, same thing. We're going to pinch right on the bottom there to protect the bottom part of the orbital rim. And we're going to come up here. And you've got 2 units here. Now we're going to come in. I'm actually doing this. Sorry, I'm actually doing this like this because to show you for the video, but normally I would be coming in like this, pinching the area. All right, but now I'm just going to come in like this just so that you could see this a little bit better. Okay, so again, we're protecting the bottom part of the orbit and we're just pinching that muscle and we're just coming in right like that. There we go. Excellent. So what do? We did 2, 4, 6, 8, and we did 4 units right in the middle. That's all you need to do. It's not a lot, but it'll really look nice. Okay, good job, patient.